Hello, everyone, and welcome to one of our 11 Together to Goal Plank Mentor webcasts. Today we'll be hearing from Janet Appel of Sharp Reese Steely Medical Group. Janet is the Plank Mentor for the Measure A1C Every 3 to 6 Months campaign plank. Janet, thank you so much for joining us here today.
Well, thank you for having me.
Tell us a little bit about you and your organization.
Okay, well, I am the Director of Population Health for Sharp Reese Steely. I'm a nurse by trade. I have many years of experience within the inpatient and outpatient world. And Sharp Reese Steely is part of Sharp Healthcare in San Diego, California. We have 22 locations throughout San Diego. We have numerous services under one roof. So at most locations, you can get your x-rays done, you can pick up your meds, you can get your labs drawn at the same time that you see your doctor. We have about 557 physicians, with about 250 of them being primary care providers. We do about 1.4 million visits a year, and Allscripts TouchWorks is our electronic medical record.
Tell us a little bit about how Sharp educates and encourages providers to measure A1C every 3 to 6 months.
So we have a diabetes steering committee, which is made up of leaders within the primary care physicians and also leaders within the quality. Population health is a big part of that steering committee. We meet every other month to discuss our goals and our strategies for bringing our patients up where we want them to be. We call it advanced perfect care. And then we talk about those strategies and then incorporate them into other larger committee meetings. Do a lot of rounding every month. Our leadership and our physicians round at all the clinic sites and try to talk to the docs about what they're doing with their diabetes population. So the education is ongoing. We have some educational materials that we fill out for the docs, but most of it is just word of mouth and face-to-face as we come and visit them at their clinic sites.
Great. So tell us about what tools you use to identify patients that are due for testing. How do you outreach to them and ensure that testing is completed?
So on my team, on the population health team, I have a whole group of nurses and project managers and MAs and community health workers that support the physician clinic sites. I do have some diabetes nurses embedded in the clinic sites, but then we have a whole team that supports telephonically the patients. Usually the telephonic work is done on patients on the physician's panel that are not coming into the office. So what we do is we have automated reports that are generated every single month. Those reports have lots of information on them. Talks about where the patient is as far as labs, what the patient needs. Do they need an eye exam? Do they need another lab drawn? Do they have the medications they should be at? What is their LDL? Are they on a statin? And so those reports get generated and we look at them and go through them, and then the patients who are not at compliance where they need to be, we do outreach with them. We either do it through the Follow My Health, which is through our EMR, or we do it by phone call. If patients are coming into the office that are on that list, we notify the office staff what they need and we see them face to face. Doctors and clinic site staff also get the same copy of these automated reports that come out monthly, and they also can work them, but we usually try to coordinate our efforts.
Great. So how do you educate patients on the importance of testing as well as the meaning of their A1C results?
Well, we do have, as I said, diabetes disease case managers that live in the office. There's also an educational team, and they're certified diabetes educators that also live in the office. So we try to make sure that every patient living with diabetes gets at least one visit from one of these two individuals to talk about education. There's other kind of WebExes and things that the patients can do, but we find the best education is the face-to-face education. Also, every time a patient comes into the office, there's a special flyer, a special handout that we've created in the Diabetes Steering Committee team, and this gets placed on the patient's chart. It's a one-pager. It gives the patient the updated hemoglobin A1C, their updated LDL, their updated blood pressure. The doctor fills in this graph. It's a very colorful, animated graph. And then as the doctor is filling in the patient's numbers so the patient can be aware of where the patient stands, he has the opportunity to actually talk to the patient about what needs would be. And then on the back of the flyer are some educational points and, of course, a phone number to be able to outreach to us so we can help them when they're at home.
Great. And our last question here for you today is, what has been the largest barrier to tackling this plank, and how have you addressed it?
So we have two big barriers. One is consistency. When you have over 200 primary care physicians that are seeing patients with diabetes, it's hard to have everyone act and treat in a consistent manner. So it's a lot of work to continue to visit all types of clinic sites and talk to all of the doctors and try and get everybody on the same page. We haven't accomplished that yet. There's still certain physicians and certain clinic sites that aren't as compliant or as consistent as other sites. It's an ongoing effort, and we just never let the message die. We always give the same message, and we always offer to help and support them if they're having trouble being able to keep up with the education and keep up with that. The other issue is access. All medical groups, I think, are struggling with this, as primary care providers are responsible for more and more of the patient's quality of care and health. Access is tough to get patients in. When a patient is over 9, we like them to come in every 6 weeks or so, and it's hard because there's not always those appointments. So we try to get patients to come in and see our diabetes educators and our diabetes disease managers in between seeing the physicians, so that opens up the access for more appointments. But again, it's not something that we've totally gotten a handle on yet.
Great. Well, thank you so much. We'd like to thank you for your time today and sharing your experience with this campaign plank. And just as a reminder to our fellow participants, if you'd like to contact Janet to discuss implementation of the Measure A1C every 3 to 6 months campaign plank at your organization, please email t2gmentor@amga.org. Please go and check out the remaining Together to Go Plank Mentor webcasts on our website to discover what other experts have done to improve diabetes care across the country.